Welcome to our fourth webinar of the Food Safety Webinar Series for National Food Safety Month. Today's topic is Food and Dining, the Future State. My name is Lisa Robinson, and I'm the VP of Global Food Safety and Public Health at Ecolab. And we are excited to bring to you today the topics about future trends and perspectives from our experienced industry panel. Okay. Before we get started, we know this is the last day of Food Safety Month, but we all know that food safety is important every day, and we're glad to have you with us. If you're not familiar, we encourage you to explore Restaurants Rise. Restaurants Rise from Nation's Restaurant News provides direct access to information, insights, and solutions. And you want to go out and explore more at this site and join the community of more than 12,000 food service leaders. Ecolab is a proud partner with Nation's Restaurant News to support the food service industry, and we want to thank them today for allowing us to partner with them to bring you this webinar series. Food safety is a top concern for restaurant guests and owners, so having a strong food safety program in your organization is crucial to instilling confidence with your customers and will drive business and help protect your brand. Through this webinar series, which this is the last installment of that, we do have all of the previous webinars that you can view on demand at the ecolab.com website. Today's webinar is focused on food and dining and what you can expect from the future of this industry. For those of you who are not familiar with Ecolab, we are a global leader in water, hygiene, and energy technology and services. Our vision is really to help provide and protect what is vital: clean water, safe food, abundant energy, and healthy environments. When we work together towards these outcomes, we improve the quality of life for people everywhere. And today we're excited to talk to you about safe food, which is one of our 4 key pillars. So our agenda. Today will feature topics regarding redefining and rethinking the future of health and food safety, and reevaluating efficiency. And we're going to have opportunity to have a Q&A section at the end. So if you have any questions throughout the presentation, please submit them via the Q&A feature at the bottom of the WebEx window, and we'll address these at the end. A couple of statistics. Sanitation will remain a top consideration, during the pandemic as well as beyond. Data Essential, who is a market trend company, provided through the first webinar some information just regarding consumers and their preferences. And in one statistic, they stated that 76% of the respondents say that cleanliness and food safety procedures will always matter more than it did before. And then they also said that 80% will be more careful to check to see if places that they go to are strictly enforcing these precautions. So food services had to, throughout this pandemic, to pivot and to respond to consumer preferences and those needs. Okay, so our first panelist is Doug Davis, and he's going to speak to you regarding how to redefine and rethink the future. Doug is a chef by training and is the Senior Director of Global Food Safety at Marriott for Global Operations. And he's got just a ton of experience, and Doug's going to walk you through, his perspective. Welcome, Doug.
Thank you very much, Lisa. I'd also like to thank the folks at Ecolab, Mindy Sedlec and Greg Cucciarella and the whole team, as well as Nation's Restaurant News, Restaurant Hospitality. It's an honor to be here today. So as most of you know, food and beverage has always been at the core of our company. We started as a root beer stand back in the 1920s. But today we have more than 10,000 restaurants. So of course, we've been collaborating with operators from around the world. We try and listen, learn, and then challenge operators and affect change as best we can from the center However, as Lisa has just articulated, it's up to these restaurants to deliberate, be thoughtful and comprehensive in addressing the sensitivities of operating in a COVID-19 world and providing guests with confidence, comfort they need to eat, drink, and meet with us. So in this social media real-time world, your operations can be exposed unless you pull through all of your protocols. And I'm going to speak to that, how we do that. I'm part of Marriott's Global Cleanliness Council, which includes experts in many fields, including Dr. Ruth Petran, who's the Food Safety and Public Health Senior Scientist from Ecolab, as well as an infectious disease physician from Johns Hopkins, someone from the molecular biology lab at NIH who works on RNA virus vaccines, as well as a food microbiologist that represents academia. So they've informed and advised our path going forward. Some key considerations that we've identified as pillars. Number one is we redefine our approach to food and beverage service, as everyone has, and that will minimize the risk and enhance food safety as guided by COVID-19 cleaning protocols. So we must go beyond sanitization to build trust. We also must be more efficient with less resources, as everybody knows. No money, no resources. Many restaurants are paring down menus from what NRN calls the bloated menu syndrome, and we're all thankful for that. We also need to rethink the ways guests engage and experience food and beverage. We have about 24 Michelin star restaurants. We have fast casual in our bistro concept at Courtyard. We have cafes. We have complimentary breakfast, club lounges. So again, owners don't have money and they don't have resources. So we really have to be creative, and we have to leverage, which is our third pillar, the relevant items of food and beverage trends and innovation from around the world, employing new technology when prudent. Next slide, please. So in terms of the future, a phased reality will be realized depending on community spikes of COVID-19. This is what we see happening in restaurants and hotels. Operators must be nimble and follow regulatory guidelines while at the same time thinking ahead, following the science closely. So in terms of restaurant operations, obviously phase one is now. Restaurant capacity has been modified. Phase two, let me back up and explain the phases first. The noted phases represent levels of risk in specific jurisdiction. Phase one is operating under an ongoing pandemic environment where risk factors are substantial and community spread is prolific. Phase two represents when customers come back on a more routine basis. And phase three is when a vaccine is available and the U.S. is approaching herd immunity. So we don't think a vaccine is an end-all for many, many reasons. So back to the table here, phase two in restaurants is QR codes, virtual menuing, and all the theatrical cleaning that we're doing. But phase three is really contact items we don't think will remain key areas. According to the CDC, there have been no documented cases of COVID-19 that can be attributed to contact with a contaminated surface. Additionally, there is no evidence to support transmission of COVID-19 associated with food. So we don't think there's any reason to be using all these disposable items in settings where food is concerned. We're certainly conscious of sustainability. And today I get bags that have all these unwrapped plastic spoons and forks and cups and knives, and it's really a waste and it's really a shame. Additionally, more than 125 virologists, epidemiologists, and health experts from 18 different countries has said that reusables are safe to use during the pandemic. Additionally, we see indoor air quality improved and touted. And my colleague Dan Goldberg will speak to this in detail, but we've been using this kind of an air purification intervention for about 16 years. We've been using hydroperoxides in restaurants like Chipotle. Chipotle has them in most of their restaurants. So we see that as a big deal. We know that CDC put up guidelines about aerosolized particles and then took it down. But we know from science that this is really a great, one of the, besides respiratory droplets, the secondary transmission factor. In terms of buffets, I'll just skip to phase 3. You know, according to what I'm seeing, buffets are going away. Buffets are going away. We don't see that. We certainly don't see that in China, where they're several months ahead of us. We see buffet restaurants coming back with a vengeance, albeit they are modified. And I'm going to show you some images of that coming up. Additionally, bars, we're going to see enhanced outdoor bar seating and weather control devices. And then the self-contained cocktails are prevalent. Florida is opening at 100% capacity of restaurants, and 33 states allow cocktails to go. And it's not just that cleanliness is the new ambiance, which it will be for some time, but not going forward in the future. We also know that New York has 67 miles of streets that are closed to vehicular traffic for restaurants. So that's going to be big, and that's not going away. In terms of service and setups, instead of an amuse-bouche with your meal, you're going to get a sanitizing wipe, and that's phase 2. Phase 3 is al fresco dining, as I've just explained, and temperature screening and those kinds of things will be routine. Next slide, please. So some companies are creating new positions like a food safety officer from a corporate context, and individual restaurants are hiring sanitation captains, as well as some restaurants have implemented health department liaisons. I was on a webinar yesterday, and Larry Sigler from Waffle House spoke about the advantages of health department communications and, frankly, friendships with health regulators. And that was on the NRA webinar yesterday. But Marriott has identified one thing that we have to do, and that's we have to have a stakeholder in hotels and restaurants in addition to the person in charge. We think it's paramount in pulling through our protocols and validating and really creating ownership. We've partnered with Ecolab globally. They have helped us with training videos. There are quizzes these folks have to take. We go in with audits, and they have to show us pictures. And here's an image of a stand-up meeting in a restaurant where they go through an app, and it's a tick box, and also the identified places of opportunities what they need to work on. And finally, each one is certified, and they have ongoing connection with us at the center. And so far, we have 9,300 of those folks that have been trained globally. And we're thankful for them, and we're thankful for all the help that we get from around the world that advise us on our path to bringing customers back to hotels. So the Cleanliness Champion is something that we're really proud of. Next slide, please. Yeah, so these are some images. We've implemented electrostatic spraying in common areas and other things, but these just are some of the images. Next slide. So there's certain things we don't want to do. We don't want to do theatrics like this. This image here doesn't help at all. It just gives a false sense of security. And But we have implemented things like we require not only associates, workers, but also guests to don masks when they enter the hotel and the restaurant. So although source control is perhaps the most effective way to mitigate virus transmission, things like face shields without a mask, bandanas, masks with exhalation valves, and knitted face coverings, as well as single-ply gaiters, not doubled over gaiters, but single-ply gaiters, these things may not be effective. Also, the overuse of gloves and using chemicals that have residual claims like biostatics or systems that spray customers with disinfectants should be scrutinized carefully. And I'm sure everyone on the phone has seen all these snake oil sales folks knocking at your door, and you really have to be careful about what you spend your money on, because our owners and our franchisees are really counting on us to direct them prudently. The next slide just shows a little bit about what we're doing. Room service, it's touchless room service. It's called Fresh Bites. They're delivering that to the room. And here's an image of a buffet. Yes, buffets will come back. I really think they will, although augmented just like this in certain ways. Next slide. So really, in a nutshell, we've employed only about 10 standards, and these were guided by our experts as well as some regulatory experts from around the world. And it's frequent hand washing, physical distancing, face coverings, and increased cleaning frequency, not only in public spaces, but everywhere, obviously. Implement hand sanitizers in high traffic areas, install barriers and partitions, implement contactless F&B, implement cleanliness champion, and flexible leave and screen for illness symptoms, which is extremely important, but very hard to mandate because of issues that are ancillary. And then finally, stay in touch with local authorities. So we have mantras like the 2-20-20, which is a heightened sanitation mantra, where food handlers must wash their hands or use hand sanitizer every 20 minutes for 20 seconds and stop and clean their workstations every 2 hours. And we were helped by Ecolab's Lobster Inc. Training wing in creating a video that really outlines this. So thank you for listening. And others, one more slide. And these are just some of the products, the F&B products that we see that are going to be long range in nature and are going to have some legs, and we're going to build these out. And these are obviously self-contained cocktails and single serve items. And I'll turn it back over to you, Lisa. Thanks.
Thank you. I really appreciate the information and, just the comments, and we'll definitely have some questions for you towards the end. I want to really probe that cleanliness champion piece. The next topic and presenter is going to speak in regards to future in health and safety, and he is Dan Goldberg. And Dan is the VP of Quality Assurance at BJ's, and Dan's got just a ton of wealth of experience as well in the industry. He's been at the Orange County Healthcare Agency as an environmental health specialist, and he's also spent some time at both Starbucks and at Walt Disney. And so, Dan, take it away.
Thank you, Lisa. It's great to be with you all here today from my dining room to, I'm sure, your kitchens, bedrooms, homes, offices. Good to be with you. I'm gonna talk a little bit differently than Doug did. I'm going to look a little bit towards the future because many of us have already pivoted towards the COVID-19 protocol world that we're in today. So we're going to be talking about employee and guest safety and wellness, what kind of technology may be upcoming in the future for restaurants, and also the importance now of future restaurants and their build. So let's go ahead to the next slide. Great. So, whenever there is some sort of a traumatic event, it has an impact on people's lives. And so if you don't mind, I'm going to share with you about my wife's grandma. When I was in college, I would go to my wife's grandma's house. I noticed that she would have a ton of toilet paper and cereal, like literally rows of cornflakes lined up. And I always thought it was a little bit strange why this lady would have so many of these staple type of items in her home. And it didn't really dawn on me until this pandemic occurred, when people started hoarding toilet paper and paper towels, is because she was a child of the Great Depression. So in her mind, it was very important for her to have stock up of materials just in case the economy would tank. And many of us have come to know the long lines at Costco's and Sam Clubs and Walmart's and trying to get the staple items for our homes. And so there's been a shift in the way that people think, the way that people consume, and the way that people think of the future. So that shift is also happening with restaurants as well. So understanding that shift, it's really important to recognize what needs to be done from not only an employee standpoint, but from a guest standpoint, to make sure that everybody feels safe and healthy. So today at our restaurants, we have disinfection stations set up. Now, pre-pandemic times, we would never have chemicals lying out for our guests to see. But today it's a new era. And we now think it's really important for our guests to notice that we use certain disinfectants in our restaurants and for them to see that we use those disinfectants so they can feel safe in knowing that their areas where they're dining are being constantly cleaned and disinfected. Now all of our restaurants have hand sanitizers available. Pre-pandemic, they weren't around for our guests, but now they're everywhere because that's been another shift. The CDC has been pretty strong and adamant about the use of hand sanitizers. And you could see more and more people are buying them and using them and seeing the importance of them. So we want to make sure that we have them fully, readily, and available, not only today, but in the future for our guests and our team members. And of course, all of us are now doing symptom screening. But once the pandemic is over, I see symptom screening continuing. It may not be to the same effect as it is today regarding all the different type of COVID-19 related symptoms. But I see a continuation of symptom screening for future types of illnesses, whether it's foodborne illnesses or other communicable types of illnesses. Onboarding and training is also going to be different. There's going to be a greater focus now on wellness. And that's really important to start new team members out with the understanding of how important not only food safety is, but health and safety is as well. So that's going to be a little bit of a shift there as well. And we've always had weekly food safety communications and safety communications to our team members. But something that we're now switching to, which will probably continue on for the immediate future, is what to do to keep yourself safe from getting sick. We're encouraging our team members to get flu shots because we know that the flu season that's upcoming can have a great impact not only on our guests, but also on our team members. With the way it is today with exclusions, if somebody has an illness, they're excluded for a minimum of 10 days, and that's a long time. So if somebody ends up getting the flu, which is very similar to some of the symptoms of COVID-19, they're going to be excluded for that amount of time. And hopefully they don't get a co-infection with influenza and COVID-19. So we're really encouraging flu shots for our team members to help prevent that type of co-infection and to keep them healthy and safe. Mind going to the next slide, please? Technology is also something that's going to be really big, not only today, but in the future. We've shifted to now provide QR codes for our menus. So our guests have the ability to either use a menu or go on their phone by using a QR code and look at the menu that way. So for those that feel uncomfortable in handling different items, they can just use their own phone to order whatever it is that they want to order, which is a great aspect and really a shift in thought. And it's pretty incredible how many people have quickly adapted to this technology. Contactless payment today is now bigger than it has ever been, and we see it as getting bigger in the future, as well as contactless delivery. Nobody wants that contact anymore. You know, as human beings, we love to give each other hugs and handshakes, but in today's time, it's a little bit different. So we're utilizing what people are thinking about and going with contactless payment and delivery as an option to make everybody feel safe. And there's a lot of discussion in regards to air quality and what that means. We do know that the CDC said something about it being aerosolized, and then they took it off. And we don't really know what the semantics are behind the scenes over there. But we do know that there's stuff that we can do in the future to help mitigate risk. So we're looking at it, and I know other concepts are looking at it as well. We're looking at different types of filters that may be used to help filter out any type of pathogens that might be in the air, whether it's an HEPA filter, or look to even something that a little bit more technologically advanced, something like photohydroionization. Something like photohydroionization, what something like that does is actually can neutralize or minimize mold, viruses, bacteria, VOCs that actually may be in the restaurant. It would never take the place of actual disinfection in itself, but what it can serve to do is actually kill pathogens that are airborne by producing hydroperoxides and peroxide-type ions that actually will neutralize those types of pathogens. So that's something that I think many concepts are looking at. I know we're looking at it, and something that we'll probably see in the future. Still on the same slide. Yeah, thanks. And one other thing that we're looking at as well, and others, is wearables for contact tracing. So a wearable is something like a watch-like thing where a team member may put it on their hand, and there's a software that goes along with it. And what it does is it automatically kicks in if a team member is within 6 feet of another team member that's also wearing that wearable. And then it also tracks the time. So instead of trying to figure out manually if somebody was within 15 minutes, within the 6 feet period or 6 feet radius of somebody, this will do it automatically for you. And so it's very quick. Of course, there's a cost associated with it, but there's a lot of great technology out there that's made itself known thanks to this pandemic. And so with all those options, it's certainly something to look at. Let's go to the next slide. And then lastly, it's restaurant build. The pandemic has showed us how important patios really are. In California, when in July the governor said, okay, no more indoor dining, the patios came, without those patios, it'd been really, really difficult to survive. So as we build into the future, patios will come under a lot of consideration on how effective and efficient that they can be to make sure that we sit our guests appropriately and maybe even make them larger or think about different ways that we can utilize it for our guests. We're also putting up partitions in some of our restaurants. Those partitions are going to go up at the booths. So it creates more of a separation between guests and their neighboring booths. And so that makes others feel a little bit more safe in regards to if there's somebody sneezing or happening to cough, where they feel a little bit more protection in that regard. And then curbside pickup has also become a really big thing. Before the pandemic, curbside did exist, but we had a lot of guests actually going into the restaurant to get their food, otherwise known as takeout. But more so today than ever before, they're picking up their food from curbside. So we see that as a huge shift, not only for today's environment, but also for a post-pandemic environment as well. And third-party delivery has played an important role as well. as others are looking to still get the great food from BJ's restaurants, but don't want to necessarily get in their car to go grab it. So they're utilizing a third-party delivery system to enjoy the great meal. And that covers it for me.
Thank you, Dan. Really appreciate those comments. And next up, we'll have Reevaluating Efficiency by Bessie Politis. Bessie is the Senior Manager of Retail Food Safety and Regulatory at Starbucks. And Bessie's got a ton of experience there, does a lot of work with their building their food safety programs, and has 27 years of previous experience in regulatory with LA County. So I'll turn it over to Bessie.
Thank you, Lisa. Good afternoon. Good morning to some others here from California. Pleasure being on this call. I've already learned some great things. So thank you, Dan, and thank you, Doug. Today, I'm basically going to be sharing with you what Starbucks is doing in reevaluating the efficiencies in our restaurant settings post-COVID pandemic. Lisa, if you could advance to the next slide. So I'm sure many of you are customers of Starbucks, and with the COVID crisis that we're going through right now, our store development team has had to look at how we're going to adjust and reevaluate the construction of both our kitchen, back of the house, and customer space, taking into consideration what the physical appearance of the store may look like from the customer perspective. As you can see in some of these photos, this is some of our new stores that are mobile order and pay pickup stores only. And they're strategically built in communities where the customer base is more of a commuter customer. They simply want to be able to order through their phones, come into the store, pick up, and not basically interact with anyone, and then take their items and go back to work or go back to their homes. And in these environments, we are speaking to regulators, building and safety officials to see how we can negotiate even parking requirements as applicable to facilities, whether you're looked at from a square footage perspective or a seating capacity perspective. It behooves many landlords to not have to have as many spaces if we can logistically explain what the customer base is like and how quick the customer can come in and out of our facilities to get their order and then go back to their routines for the day. The other thing we're taking into account is, again, the physical distancing issues that both our customers and our employees are really looking at in the future. That would include reducing our seating capacity in our stores where they are more community-based, and we do want that store to be the third place, as we call it, for our communities. But again, we're looking at reducing our seating capacity between customers, our community tables where single customers could go and just sit individually and do their work and consume their beverage are probably going to go away. And then more single type tables will be set up. As I said earlier, workers want safety, but they also want safety for the customer. So how are we going to adjust this? How are we going to communicate the value add to the adjustments that we're going to make structurally in our stores with our staff and with our customers? As Dan had indicated earlier, and Doug, the perception that we offer our customer post-pandemic is going to be exceptionally important, and it's going to solidify for that customer and the employee just how well your food safety practices and your cleanliness practices foundationally are in place. And it's going to have to be more visible. As Dan said, you're going to have disinfection statements, chemicals throughout your facility that normally would not be visible to a customer, but now it's actually an effective way of sharing with your customer and your employees that you are committed to providing a safe environment for all. The concern around having to adjust structurally as well in a Starbucks environment is our mission statement in keeping that human connection with our customer. And so in environments where the mobile order and pay is strictly a customer coming in and picking up, you don't have that opportunity to make that connection with someone, where in our community stores, some of our stores have become a second home for many of our customers. This is their only time that they actually interact with individuals. And so when we're putting all of these precautionary measures now moving forward with distancing and reduced seating, those are the customers that we're concerned with, that we may lose that person-to-person connection. The efficiency of Starbucks. So we believe that we have created a small space but have become a very efficient engine behind the line there. Now with social distancing, and in some states where we're required to have distancing amongst our employees, that small footprint is going to be quite challenging moving forward. So we have to rethink construction on that as well. The rise of automation and artificial intelligence will certainly help make space for we call our employees partners, to have that human connection by reevaluating how we're going to implement automation and artificial intelligence into our stores more effectively. So that frees up our employee to make that connection. If you could advance to the next slide. And then my last slide is around sustainability. So Starbucks is very committed to this topic. And what will this look like post-pandemic? We are huge proponents of a customer using their personal cup when they come into the store. But as you can imagine, our employees are very concerned around having contact with someone's personal cup or item. Obviously now we're not implementing that. We've taken that out of our stores, but we're looking to put it back in from a sustainability perspective. But if there are some states that are going to preclude the allowance of this, we're obviously going to be increasing the use of single-use items. In some states, there's very stringent requirements around compostability of the particular single-use item. So what are we going to see in the future in terms of single-use development from various companies, and what will they afford us so that we can still continue with our foundational commitment to our environment? And we're also going to look at what companies will be able to provide us with a single-use item that will be able to hold an item hot enough, hold a cold item cold enough, be able to be durable enough to be transported or delivered, while at the same time being able to be recycled in a safe and effective manner. And that concludes my presentation today.
All righty. Okay, well, thank you, Doug, Dan, and Bessie, for, just some really great comments. And before we dive into some Q&A, a couple things that we want to just make sure that our viewers know. If you have any needs in terms of COVID-19 response and recovery resources, Ecolab has them. If you go to ecolab.com/coronavirus, plenty of resources there and information. And then we also have at ecolab.com several resources just in regards to both food safety and public health. So jumping into kind of our Q&A section, there were a couple of key themes that I did see or hear from our presentation. One is that, customers need to see clean or need to see some of the new standards. So by having disinfection stations and the barriers and people wearing masks, they need to see that. Also, that each of you have had to somehow modify your site physically to accommodate either for physical distancing or even to, have, people be able to come in and get products and easily get out. And then the other piece is just the use of technology. It seems to be a common theme across the board. So I want to step back and maybe start with you, Doug. I've got a question just in regards to your cleanliness champion. Tell me, you had mentioned that from a cost perspective that, you can't really add any, money to a lot of the things that you're doing. So from a cost perspective, you have to be very wise right now. Tell me about this cleanliness champion. How are you able to add that type of position to your organization given this time?
Yeah, thanks for the question, Lisa. This will be an existing position. So every restaurant GM is responsible for identifying somebody that's existing. And globally, we have hygiene managers in every Asian hotel and most European hotels. And we have food safety folks in every U.S. hotel already. So these are the natural folks that would go into these positions.
Gotcha. Thank you. And this question goes out to everyone from a technology perspective. We talked about, air handling. I think, Dan, you touched a little bit on photo hydration. And, Betsy, you talked about a little bit of AI. What other technologies are you looking at? I heard maybe contactless menus. What other technology are each one of you, if you each could answer that you're looking at that maybe you didn't speak to today? Start with you, Dan.
Well, Lisa, we're looking at a whole bunch of different things, but I really spoke to everything that we are looking at that's more primary than anything else. Everything that we're looking at does have costs associated with it, so we have to be mindful of everything that we're doing, the resources that we have to make sure that our guests and our team members feel safe, yet we're doing it in the right way.
Thank you.
For us at Starbucks, to Dan's point, we have to look at cost factors, especially given the business climate right now. However, one of the things we see technology assisting us with is we implemented a virtual coach during COVID that requires our partners to actually log in and answer a variety of questions. And they do this before their shift to ensure that they are cleared to start work. In conjunction with that automation, we're looking at implementing a methodology in assessing our stores internally in conjunction with our third-party assessments or health department inspections. But again, having it on a computer, on a laptop, where our store managers or supervisors can walk a store and we can set up a specific set of questions either bi-weekly or via monthly that we want to target and assess and get real-time information back based on what we're seeing from those third-party assessments as well. So we're getting visibility on a daily basis of how we're operating and what we need to improve on with our practices in our stores.
Thank you. Anything you want to add to that, Doug, at all?
Well, we've set up a test site at a Colorado hotel, and we're testing everything we can get our hands on. That includes things like UVC. We have advocated a small box that we use to disinfect things like handheld devices, room keys, etc., shared devices, etc. We're looking at everything from cold plasma to robots. The Nova rover was the last thing we looked at. We're looking at all the new face coverings, including the see-through face coverings, the antimicrobial face coverings, and so forth. We'll continue to evaluate these, continue to evaluate disinfectants, and get some real-time measurements of how effective they are and how good a job we're doing cleaning, cold plasma, and the list goes on and on and on. And really, out of every 50 of those, we may select one as serious.
Gotcha. Okay, thank you. A couple of questions that we have from our audience. We have a question regarding to as the weather gets colder, right? I think you mentioned earlier, Doug, that New York has so many miles of streets that they've dedicated to or stopped traffic to, be able to host people. As the weather gets colder, how should we be handling coats and jackets? What kind of recommendations do you all have for any of handling of that type of material from your guests or from your patrons? I need to pick someone. I can maybe pick on you, Dan. Like, from handling coats, jackets, or are people just keeping them, or what are your thoughts about those?
Yeah, so we don't have anybody that's in today's environment or even pre-pandemic environment that would handle a guest's coat per se. A guest would walk into a restaurant, take off their jacket or their coat, and place it on their chair. And one of the great things we're doing today is we're also disinfecting the chairs. So from that standpoint, once a guest leaves and whatever they put on the chair, it's going to be disinfected afterwards.
Okay. Any other panelists, any other perspectives?
For us, it's all self-service. The racks are now out. They put their coat on the rack and they pick it up. And there's really no system that's been developed to date.
Okay. Let's see. We've got a couple other questions that we can pull from the listeners. Let's see. Can you share your perspective on the use of food handler type gloves in non-traditional, non-food handling tasks, like in front of house positions such as servers or cashiers?
Yeah, I can help take that one. We initially started using gloves with our servers during the pandemic, but then recognized that gloves may not be as safe as everybody thinks they are. So we immediately moved away from gloves for servers. Our food handlers are still wearing gloves. It's still an important food safety aspect to prevent foodborne illness. We also have our server assistants, or otherwise known as bussers, who are wearing gloves as they're handling guests' plates after guests dine. But our servers know that if they handle a plate after a guest eats, that they're washing their hands, because washing hands is the primary in reducing all types of pathogens. And that is the education and the approach and the protocol that we have at BJ's.
Thank you. Any other comments from the panelists?
I can add to that. It's also affecting dishwashing staff with respect to gloves. I concur with Dan, and so does our company, that gloves can have that false sense of protection, as we all know, and so hand washing is the most critical. However, with dishwashing staff, we're finding that glove use now, when they are handling the dirty smallwares, are then taken off and hands are washed, and then new gloves are put on when they're handling the clean smallwares and stocking them. They're also wearing goggles, and they're also wearing aprons when they're in the process of washing dishes, as in some states it's required for dishwashing staff. But in those critical positions where there is a handling of a smallware that has had contact with a customer's fork, knife, spoon, whatever it may be, I see gloves being effective there. But other than that, hand washing, I think, is by far, feeling something on your skin is by far much more important in triggering the person to want to wash their hand than having that covering over their skin and not feeling it, and then continuing to work and create cross-contamination and ultimately causing the foodborne illness.
Gotcha. Thank you. Thank you. Another question I have is, I know you're doing a lot of things to help your guests, continue to come back in. How are your employees responding to some of the mitigations that you're putting in place?
They respect it. They know the importance of it. They appreciate it because we're not only protecting our guests, we're protecting our team members as well. So we take pride in knowing that we've put in so many great protocols in place to protect so many people, to make sure that everybody has a comfort, whether they're dining at BJ's or working at BJ's, knowing that their protection is our primary concern.
And to add to that, I think that this has given all employees a greater heightened awareness of why food safety and cleanliness standards within any facility have always been preached, but sometimes they go in one ear and out the other, so to speak. And now we are seeing what the pandemic has done. Obviously, anybody that's working in food safety in a company has now become the favored employee of the year. And so we find that our employees now are really looking at our standards with a lot more scrutiny. They're completing their tasks as we've expected them to do. They're lessening their shortcuts because they understand now the whys behind disinfection, sanitizing, hand washing, not coming to work sick. So they value it. And to Dan's point, I think that they feel very protected, very supported, even as it comes to their exposure to customers and what we've done for social distancing and barriers and facial covering requirements. It's very respected and appreciated by them.
A couple final questions for you, and this, would pertain to anything that's being like as a takeout or maybe delivered. What food safety measures are you following to just assure that last mile is safe, in terms of food leaving maybe your site and going to a consumer's home?
I think it's a great question, and it's certainly evolved over time. I think we've all learned from the beginning of delivery to where we are now, the real importance of making sure that all food is completely sealed up. We want to make sure that nobody has the opportunity to get into the food unless they're the ones that are actually purchasing the food. And we've also developed mechanisms to ensure that the timing is okay. So we don't want food to be ready and sitting out for an extended period of time, because not only is it a safety issue, it's also a quality issue. So we've also input procedures to make sure that there's timing aspects. And if the timing is off, we're going to refire it again to make sure, not the same thing, but a whole new version of it to make sure that our guests get the highest quality food and the safest food possible.
Thank you. Last question, or maybe second to last question. This one's for you, Doug. In terms of, you had your levels of risk. How did you decide those levels? Did you use your counsel? And how do you keep up with, and I guess this could apply to all three of you, how do you keep up with the changing regulations at a local level, right? So start with you, Doug. Tell me how you came up with your risk categories or your phases.
Yeah, you're right, Lisa. It was based on our experts. It was also based on, frankly, the experts around the world in restaurants. And we have stakeholders in, as I said, in every single operation, and they monitor, because we certainly couldn't do it. It's not sustainable. They monitor regulatory issues and react accordingly. So all of our brand standards can be supplanted if the local restrictions are more, are over and above what we require, but they can't go below. Yeah, it's not an easy thing to do.
We have at Starbucks field teams that support a particular geographical area of the U.S. and Canada, and also in our European, Asian markets. We developed during this pandemic what's called the intake form. And as regulations change and adjust, it was done by state, and then we broke it down by county, by city. So each field partner was required to go in and share and answer questions that were specific to regulations so that we could see straight across the board what were the common themes of all the regulatory agencies and where do we have to comply from the highest level. Because we have so many stores, we certainly couldn't have every state operating differently. So that was a huge help to us by developing that intake form. But it is a very difficult task because some agencies are very good at letting you know just on their website what the expectations are, where other agencies that are smaller or divided, they don't oftentimes update them as frequently as one would like. And so you would find out about non-compliance simply by an inspector walking into your facility, and we'd say, we had no idea that this was a requirement. So sometimes it was just, resolved because of that. But in general, having a strong relationship with your large regulatory agencies is incredibly important, because typically what the larger agencies will do, the smaller agencies will follow in those footsteps. So that's one thing that I had really pushed for our field partners to do, is to connect with your regulators, attend the local meetings, be part of their industry and regulatory joint meetings, so that you have an opportunity to get information at a quicker pace than relying simply on having to investigate it on your own, via the web system.
Yeah, and we don't have quite the stretch that Starbucks has in regards to field partners, but what we do have is network availability. And there's a group of us QA professionals that meet almost really on a weekly basis. And we discuss a lot of aspects of COVID-19 and learn from each other in that regard. So that network that we have with each other, we're learning from each other and building upon that and making all of our concepts that much better and that much safer.
Well, thank you, Doug, Dan, and Betsy. This has been just a phenomenal opportunity to talk to some really great partners that's out there in that food service space, and to provide our listeners with some really great information from your background and your experience. I think we'll start to wrap it up. I think the last couple of slides I just want to share, from Ecolab perspective, and I think you all mentioned some of these on some level, but our risk, management strategies that we follow from the CDC and the World Health Organization have been pretty standard in terms of wearing a mask. If you are sick, staying home, avoiding close contact or, the physical distancing, washing your hands, covering your mouth and nose when you sneeze, and cleaning and disinfection of those high touch points. And I think we also talked about increasing ventilation where possible in the indoor environments. Last slide is in regards to the Food Safety Month webinar series. All 4 of the webinars, including this one today, will be able to be viewed on demand at ecolab.com. And, hopefully that these webinars have been able to provide you with some really great information to take back to your operations and to, help restore confidence in your operation with your employees and partners and associates and with your guests. And with that, I want to thank National Restaurant News for allowing Ecolab to partner with you in putting together this webinar series. And I want to say one last thank you to our panelists today who have really hopefully brought to light some of the future trends in food and dining. So thank you.
Thank you, Lisa.
Thank you. Bye now.